One of the things that you may not know is that many people don't report their falls. And if you don't report your falls to your physician or to a family member, or you hide the fact that you're having falls, that in itself can lead to a higher risk of future falls. And we just encourage you to utilize the information that you're going to learn here today and learn to have that discussion, because it will help save you in the future. No one wants to fall. Now here's an important note, and if you only take one thing from today's presentation, I hope this is it. There are reasons that people fall, and being old is not one of those reasons. Falling down is not a part of the normal aging process. We're going to talk a little bit about what causes falls, but I want you to know that falling is not something you have to deal with. There's a solution. Now here are the better known reasons for falls. Medications. We can have medication interactions, muscle weakness. Sometimes we don't move around as much as we did when we were younger, and our muscles become weak and not able to support us. Perhaps a lack of flexibility in the heel cord, the hamstrings, the hip flexors. Sometimes even in our neck, and a bad posture can lead us to more falls. And then there are vision issues that, of course, can lead to those falls. And then environmental factors, uneven sidewalks, pets, throw rugs, those type of things. But did you know that the fear of falling in itself is a risk factor for falls? In fact, it was published in the British Medical Journal in August of 2010 that the fear of falling, or even the perceived fear of falling, could in fact increase one's risk to fall in the future. So we need to address that fear. A healthy concern is okay, but fear is not okay, because that can lead us to restricting our activities, restricting the way we socialize, and can actually lead to an increased risk of falls. Also, not reporting a fall. Remember, falls have a reason, and we just discussed a few of those, and your physician should have a checklist that he or she will go through you if you have a fall, and make sure it's not a medication interaction, or you're not dehydrated, or that maybe you need a special physical activity program. But if you don't report those things, you won't find out why you're falling. And then not being assertive. When you need help, or if you need an assistive device, or you just need to hold somebody's arm in a crowd, if you don't ask for that help, you're not going to receive it. And if you don't get the help you need, that could lead to a future fall. And then, of course, we talk about not asking for help. We're very prideful people, and it's hard to ask for help, but because to us, that's an admittance of weakness. But in fact, if you are asked for help by someone who needs your help, most folks will give that help willingly and happily, and it really adds a certain kindness to our life. So if you don't ask for help, you're robbing someone of the blessing of giving help and help assisting in another one's life. So keep that in mind when you're not wanting to ask for help. Well, these two lovely people are my mom and dad, and I'm going to talk a little bit about my story and the things that I have learned over the past few years. In my career, I am a facilitator or trainer for several evidence-based programs. And those are programs that have gone through clinical research, and now they're community-based research, and most of them are geared towards older adults and dealing with chronic conditions, or becoming more physically active, or fall prevention, or even exercise. And through my learnings, I thought that I sort of knew it all, and I thought I was going to help my parents be more healthy. And so I sort of rode them pretty hard. And if they were sick, I would make sure I went down and make sure they take their medicine and drink fluids, and I would nag them about exercising and blood pressure and cholesterol, until I began to hear the people in my classes talk about how they felt about their children that did the same thing that I did. And some of the folks in my class would tell me, I can't talk to my kids about falls because they'll put me in a nursing home. Or I'm afraid to tell my daughter that I've been diagnosed with diabetes because she'll change everything I do, or she'll be disappointed in me, or she'll nag me. And this started to sink in that I was doing the same thing, that I was helping these folks communicate with their kids, but I was doing the same thing to my parents. And I began to notice that I wasn't finding out if my parents had a fall. I wasn't finding out if they had health issues because they weren't talking to me anymore about that. And so I want to publicly apologize to my parents, and I have been working on that. And now I just want them to enjoy their life. And I do want them to rely on me, but I also recognize a couple of things, and let's talk about that relationship. First of all, I need to remember to honor my parents and recognize that I'm still their child and they're still the parent. And this is how I think about that. When my mom and dad look at me, they probably see me in a diaper. I know that sounds silly, but truly, I'm their baby. And when the baby decides to become the parent and tries to switch into that role, it's never very successful, and it's not my role. It is my role to care about and love my parents and help them when I can, but I can't become their parent. That's not how it works. So in having the conversation or getting ready for the conversation, really internally, you need to remember that these are the folks that held your hand when you were little, that dried your tears, that kissed your boo-boos, and you have to think about that and how they think of you. And then always acknowledge your past mistakes, and if necessary, apologize for those mistakes. And here are some tips about having the conversation. It's frustrating when we can't help someone, especially if our parents are having failing health, or if they're having falls, or if we know that there's a fall risk. It's so frustrating not to be able to fix that. And sometimes we get sort of judgmental. So you want to avoid you are having falls and you are not doing anything about it and you won't throw your throw rugs away and so forth, because that's accusatory and it really puts people on the defensive. The best way, I think, to go about that is to talk about the I message, or how you feel, and say, you know, I am worried about you and I don't know what to do about it. And I just want to have some peace knowing that you're okay. And what can we do to help that along?